My name is Heather Bell. I'm a social worker with BJC Hospice and Palliative Home Care, and I wanted to talk about some of the most important preparations that we can make in our life that we generally don't even talk about. So there are certain milestones in our life that everyone knows to prepare for: a new baby, a marriage, schooling, a job. But as a society, we neglect to discuss a significant part of our lives, which is our own end-of-life care. So everyone deserves to be able to live out the last chapter of their life in a dignified way, to be able to live and die with dignity. But how this is determined really depends on the preparation we make for it, and how our wishes are honored. Advance directives are one of the ways that we can make sure that our wishes are honored. It describes the medical care that we wish to have if we were unable to speak for ourselves. For instance, if we were in a sudden accident or illness, without these directives, we're just leaving it up to chance as to what type of care we would receive. And so having particular forms to use to state what our wishes are the best ways to go about it. And you can get these forms for free from your health care provider. You can get the forms free online. Each state has their own version of these directives. And you don't need to have a lawyer to draw the papers up. You just need a notary to notarize the forms and have witnesses for that. So the two most important types of advance directives are a durable power of attorney and a health care directive, or what some people call a living will. So the durable power of attorney is where you choose an agent to speak for you if you're unable to speak for yourself. So you're wanting to choose somebody who knows what your wishes are and can carry those wishes out if you were unable to speak for yourself and were in some kind of a crisis situation. And then the health care directive is a document where you can state your choices regarding any aspects of your health care wishes. And usually in that health care directive, there's a list of medical treatments that you can specify what you would want at end of life, but you can certainly adapt that directive to your own specifications. But what I feel is the most important thing in preparing for end of life is that you have your agent with the durable power of attorney form who knows what your wishes are, and that you have these conversations over time with your agent, with your loved ones, with your healthcare professionals, with anyone who may be involved at that time to be able to carry out your wishes. So it isn't just about your medical condition, about what's the matter with you, what's wrong with you. It's also about what matters to you. How do you see the end of your life going? Who's around you? What are the sights and the sounds and the smells, and where do you want to be? These are all things that you can factor into the advance directives, into these conversations. And there is no time that's too young to discuss it. As far as I'm concerned, if you're old enough to vote, you're old enough to talk about these end-of-life wishes and to be able to get documents in place. So I know it's not easy to talk about your end-of-life wishes, but it is one of the most important conversations that you can have with your loved ones, and it certainly takes the burden off them in proceeding as your advocate. So you can ask a medical social worker or a case manager how to proceed with this so you can get the paperwork in place, or in accessing resources to have these discussions with your loved ones. Thank you.